Welcome to ACE 2009.
And Louis, I understand you've used Allscripts products about 5 years.
Yes, that's right.
Can you tell me how they've changed the practice?
Oh, it's changed everything about our practice. In fact, we just won an award as one of the top businesses, or the top business in Kansas City, small business. And part of the reason we won that was because of our commitment to technology, and it's streamlined everything we do in our practice. It enables us to have a much higher patient quality experience. The physicians are obviously able to access all of the information, and we're able to connect at all times, and just the database makes you able to have such great information to improve quality of health care for our patients.
It must be very gratifying having that get noticed by
oh, absolutely. Yeah.
Tell me about return on investment. Has it provided appropriate return on investment?
Well, I would say with all technology that the investment for us is greater quality of patient care.
So Mel, talk to us about your iPhone usage, the Allscripts remote.
It's something that I've just started using in the last couple of weeks. Now that I have it, it's one of those things that I can't imagine not having it in the past. It allows me to sort of do work when I'm away. Allows me to sort of respond to things on my own time, on my own schedule.
Use it every day, every hour?
I wouldn't say every hour. I would say maybe every day. Obviously, I'm away from my office this week, and it's allowed me to sort of keep up with the workflow and keep in touch with my nurses, and actually keep in touch with some of my patients as to more of the some of their chronic care issues, some of their monitoring.
And what functionality do you use of the iPhone application most particularly?
Especially while I'm on call, it's handy to sort of be able to sort of consult a patient's chart if I don't have my computer in front of me. If I need to write a prescription on the fly, it's great. I have all their information. I have their allergies. I have the pharmacy information, and I can just send the prescription right away, and it's there. If I need to send somebody to the emergency room, again, I have their information, and I have the ability to sort of forward their information to the hospital. So it sort of establishes that continuity of care that we're all looking for these days.
Wonderful. We've heard a lot about connectivity today, of course. How many different entities are you connected to? Laboratories, radiology facilities, and things like that?
Wow. I would say probably 30 different entities, but we are connected to these different entities in various ways. So I'm really just throwing out a number that I think is safe, because we're connected to different doctors' offices, we're connected to hospitals. We're actually not only working with physicians, but we have a health information exchange. So that's why I'm saying, that's a safe number, but it depends on how you look at it, because some of our doctors' offices are also connected to the hospitals.
And tell me how their technology has helped the quality of medical care.
Well, it's a tremendous platform. The biggest savings, number one, is everything's legible. Legibility is number one. Number two is information everywhere. You can view it and see it everywhere. In my current role at Queens Long Island Medical Group, we have our entire organization using Allscripts, 300 doctors, 22 locations, hospitalists, home health care,
and each
care
physician
management.
Has instantaneous access to all of the information.
Wherever they can get it on the internet, they can see that information. So our information connectivity is what's really important.
Tell us about your experience with Allscripts.
It's been great. The integration between, we have the professional management, the scheduling, and the patient management system. We also have the electronic medical record. We've had it for many years. We really do like it.
What's your favorite part of it? What's your favorite set of features?
The fact that when the physician is done with the patient, it's done. I mean, the note's done. We have no medical transcription at all. It's completely click and choose, but it still can be customized as well for the physician and for us. When we're done with the patient, the physician has the prescription there. They have the test ordered, everything, and you really can track the patient, follow up where the patient is in the system. We really enjoy it.
And I understand that you saw Glenn Tolman's keynote address. What are you looking forward to in the future?
I was really impressed with the fact that he was talking about being able to link all Allscripts clients and being able to say, well, if this patient went to one particular physician for a specialty and they used your product, we may be able to glean some information from there that would help with the overall patient care.
How many facilities are you currently connected to? Laboratories, radiology facilities, etc.?
2 laboratory facilities, but we also have 5 locations. So we have 7 physicians, 3 nurse practitioners, 5 locations, hospitals.
And those 5 locations share information instantaneously, yes, and with the hospitals as
yes,
well?
Yes.
Jerry, thank you very much. And Dr. Miller, tell me about your experience with Allscripts products. When did you first start using one?
Well, I am one of the oldest users of Allscripts. We are now entering our 13th year.
Wow.
It is probably the most significant decision that we made. I can show you value after value that the EMR has allowed us.
Give me an example.
Well, today I have 154 providers, 287,000 patients registered to us. We are a freestanding medical group. And we are the preferred group in our MSA, and I think a lot of it is due to our EMR.
So Keith, tell me how Allscripts has affected your business.
Well, we were actually voted the #1 small business in the Kansas City area this year by the Chamber of Commerce, and this is a competition among 1,500 businesses. Very few of them are actually medical, and the judges were very impressed by our EMR and the way it functioned. We demonstrated it for them, and they were extremely impressed. I think a lot of the judges had been in doctors' offices where paper records were continuing to be used, and so they were impressed with our ability to retrieve data, transfer data, and I think that was one of the integral aspects of our office that caused us to get this award.
Nice to know Allscripts can do that.
Yeah.
Anything else you'd like to tell us about Allscripts?
Where to start?
You've got time?
Yeah, I guess. Well, it's an amazingly flexible product. You have to put some work into it, but it does pay off. And well, my CEO often asks us, do you think you did the right thing? Do you think that this is really the way to go for medicine? And every time, even though it's been hard and there's been challenges and it's been a very steep learning curve, it is definitely worth the effort. And I've always said that this is our generation's antibiotics. It's what we have to contribute to the next generation of physicians.
So would you want to go back to paper?
Never. Never, ever. That does it, right? That says it all right there. So, yeah, thank you.
Thank you.
Hi, this is Dan Michelson, Chief Marketing Officer for Allscripts. I want to thank you for coming to ACE, the Allscripts Client Experience. Thanks for watching.